Hi, I'm Dr. Johnny. Thanks for joining me for Raji's Quick Clip. We're talking today about old versus tired. Someone on YouTube here asked the question, hey, I'm not looking tired so much as I look in the mirror, I'm now looking old. What does that mean? What are they telling us? Is there a distinction? Is there a difference? You get aesthetic services, are you looking old or tired? And then remember, there's also angles, but today we're talking old and tired. This is a quick clip. Let's get to it in 3 seconds. So old versus tired, there's a huge distinction. When you go into your aesthetic provider, short angles might play a role. I want a higher cheek, chin projection, lip volume. But for a lot of patients over the age of 40 particularly, they're going to say, I look tired or I look old. Or I looked tired and now I'm looking old. I want to show you what looking old is. When a patient comes in and says, I'm looking old, or you see someone. Do you ever go to a reunion or go to dinner? Maybe there's 3 couples or 3 different groups, and you sit down and you look at one and you go, wow, they aged a lot. I hadn't seen them in 8 months, a year, 2 years, and they look very different. What is it that you're seeing? We'll talk about that and I'll explain it. Remember, if you like the videos, click like. It helps us on the YouTube algorithm. We can put more videos up and they improve what we're doing. And also, don't forget subscribe. And remember, if there's a topic you like lips or jaw lines or old versus tired, go into the playlist and you can play through a few of them, because if you're getting services or interested in getting services, it's all about education. And if you're a provider, you can send these videos to your patients before they come in so they're educated on it, or better yet, make your own YouTube videos. So let's talk about it. So here's a more youthful face, and as it graduates over, it's looking more old here. Here, the envelope of the skin is pretty good, the eye position's still good, but maybe this is a more tired patient. What's the difference? We're talking more and more about taking care of the skin. We know the muscle, the DAO pulling down is going to turn the mouth downward. It's going to create some lines and wrinkles. That's what our neuromodulator does. And here we have a constellation of many problems. But when you see someone and they particularly say, I'm looking old, what is it? Any guesses? Exactly. The bone. The bone is what plays a big role in supporting and in the facial structure. But let's look at a comparison of older and more youthful bone. That will tell the story. So let's start with the jawline, because this weekend's video is going to be all about the jawline and a new technique, a newer technique of how I'm doing some jawlines with higher dose kind of products and biostimulators along the jawline. But what I want you to notice before we get into that video on the weekend is this. Look at the ramus, look at the jaw here. It's nice and healthy, good dentition. It's wide. As you look here, the jaw narrows, there's less bone. The head's on a bobble, so it doesn't see a lot of resistance. And what happens is you get osteoporosis where you don't get resistance. If you're not walking around, your hips don't see strain, they don't grow bone in a sense. And you can see over here the thinning of the bone. But let's look at the frontal projection, because that really tells us something. So if you look on the frontal projection, what you can see, especially with the eye socket, demonstrates it really well. The eye socket, here's a youthful one, and as we age, the distance increases, it rotates the wrong way. Temporal hollowing, changes in the maxilla, in the front of the face, along with the jawline that I showed you. And we all know about dentition, and that's where platelet-rich fiber, and that I talk a lot about. Dentists use a lot of that to put, when they're putting teeth in, people that don't have the best bone, and the dentition plays a role. But if you study the bone, you'll understand why someone comes in looking old, and that's the time to think about hormones, because as estrogen goes down for a female, they're going to get more bone loss, and that's often a time where you see between 45 and 55, you say, they're looking older than they did a year or two ago. And it can happen within months to a year to two. And when you see someone who's younger, maybe in their 30s, it's worthwhile to ask and see whether that might be early menopause or early estrogen changes, and I think we see in normally people in their 30s and late 30s, early 40s having estrogen changes, and you see it in the bone. So that's why we mimic the bone. That's why we use the products that do that, because if people are looking old, it's often the bone. So there you have it. Watch my jawline videos, and this weekend I'm going to show you on video on the YouTube how I mimic bone in some cases to recreate the process that we all don't like. Thanks for joining me. Keep your skin and body beautiful, healthy, and vibrant.